Hi everyone, Dr. Stephen here. I'm a ENT surgeon. So this video going to be regarding nasal problem, out of which the most commonest problem is rhinosinusitis and polyposis. So rhinosinusitis means it is due to exposure to lot of allergen and toxic and including food items causes inflammation in the nose, and patients start having nose block, sneezing, headache, snoring, low quality of life. We are all obligative nasal breather. If you don't breathe through the nose sufficiently, through the nose, you can have lot of multiple medical problems. That is why a patient should smell well, breathe well through the nose, then that person will live like a superhuman. So you person who has nose block severely more than month or two, and patient have lot of inflammatory tissue, patient have CT scan shows fungal infection, definitely he needs a surgery called functional endoscopic sinus surgery. This functional endoscopic sinus surgery only I am going to describe fully how it is, what it is. During advent of these surgery, we were all doing manually removing the polyp, manually cutting the turbinate. Those surgeries were performed exactly 15 years back. After advent of endoscope, a person, Aus and Messerklinger, these two, they went to urology department. In urology department, they kept seeing, similar to nose or urethra, they used to put a scope and remove the prostate and other surgeries. That time, Messerklinger saw that. He said, why not we use it on the nose? Though it is 75-degree scope, they were using for prostate. He has taken that 75-degree, put it in the nose. He wrote a book called Functional Endoscopic Sinus Surgery. That advent became very popular nowadays. Throughout the world, everybody, we have 0-degree, we have 30-degree, we have 45-degree endoscopes. These endoscopes are used like this. I'm going to show you 45-degree endoscope, which is like this. It has a sheath. You remove the sheath, you put a light source to it, and it comes on the TV. You hold like this and pass it in the nose. Wherever disease is there, nowadays we use laser to reduce the size of the turbinate and remove the polyps. And we also use microdebrider assisted functional endoscopic sinus surgery, which also will be described, and videos will be displayed and told. This is mainly my patient to know what it is, how it is. It is very simple. You take a patient for functional endoscopic surgery, either do a X-ray or a CT scan is better. If a CT scan shows conchobulosa or enlarged inferior turbinate or polyp in the nose, or have a fungal sinusitis, inflammation in the maxillary frontal sinus, these are all minimally we have to do. People are nowadays concentrating very minimal surgery. You should not destroy normal tissues. Maximum protection to normal tissue. Deal with only diseased mucosa. If you do that, post surgery, patient has to wash the nose with saline or salt spray. There is a spray available. You can spray in the nose and blow 2-3 times a day, and patient should come weekly follow-up, cleaning, all that. Patient will be ready within a month. Patient will start breathing better, smell better, absolutely fine. So patient advice is, if you have crusting, blocking, you need to approach the operated surgeon. And most important thing is, do not clean yourself. Putting a bud and trying to remove, no, it won't come. You have to approach the surgeon. Most of the time with the saline itself, it will separate and clean. After that also, we give lot of dietary advice and wearing a mask in a dusty atmosphere prevent animal at home and prevent dusty, any construction going on, your wall, everything should be clean, spray clean, and keep a air purifier. Very, very important at home. Pick up air purifier. It is very good for rhinosinusitis.
Doctor, are there any alternatives to surgery that I can try first?
Yes, most of the time, the surgery selected people will always tried with medication. That is dietary plan, what we have. 2, avoidance of pollution in your thing. We do blood test called CRP and inflammatory markers. In that, absolute eosinophilic count is very, very important. If it is more than 700, that has to be brought down. Then we give them steroid nasal spray for a month. We give them antihistamine, mucolytic, and thorough nasal wash. That is called nasal douching with saline.
Doctor, what is an absolute indication for surgery?
Absolute indication is complete nose block, severe headache, sleepless night. Patient after receiving medication also it is not relieved. Those guys need to undergo functional endoscopic sinus surgery.
What are the risks or complications associated with FESS?
If you are experienced, there is no risk involved, including children should not have any complication. Of course, small complication, puffiness on the face for some time, usually all are controllable, they'll become all right.
Doctor, how many FESS procedures have you performed?
More than 1 lakh.
How long will this surgery take?
20 to 30 minutes max.
What are the imaging or tests I should do before approaching you for surgery?
Basically, if you're coming for surgery, you have to meet and get investigation by us. That is basically bleeding time, clotting time, platelet count, and surgical profile, serology, and liver function, like that.
Doctor, are there any risks to my sense of smell, vision, or brain?
No, absolutely it should not happen. If the surgeon having a complication, he should know how to treat it. Patient may develop little anosmia post-op, that is because of the laser usage near the middle turbinate. That can be easily controlled.
How long is the recovery period, doctor?
Patient usually recover in a month time, complete recovery.
Does the patient need to stay overnight in the hospital?
No, it is a daycare surgery. Usually children under GA, we keep them 1 day.
Is this procedure normally done under LA or GA, doctor?
All adult, we do it under local with anesthesia standby, because nowadays the insurance people expect under GA and admission shown 1 day. So that purpose we keep them a day.
From a scale from 1 to 10, how painful is this procedure?
Actually, it's very, very simple and it is not painful. We give nasal block into inferior alveolar nerve, turbinate, middle turbinate before surgery. So the patient usually they'll have prick sensation. That also we spray with 10% and we use adrenaline and xylocaine 4% packing before surgery. That should not be any problem.
When can I return to work or normal activities, doctor?
Within a week's time, you can go and work.
And how often do I need to come for follow-up appointments?
Usually tell patient to come on 2nd day for cleaning and weekly after that for 4 weeks, a month follow-up.
Is there a chance I will need another surgery after this?
Usually no. If you follow up the patient properly and give them instruction, nobody will come back for surgery.
What should I do if I experience some bleeding or other complications at home after surgery?
Mild bleeding, nothing to worry. If it is severe bleeding, patient should approach us. Usually it happens because of the vascular genesis happens in cauterized area or laser area. That has to be again cauterized.
What are the signs of infection or complication that I should watch out for?
Foul smelling, discharge in the nose, severe headache indicates mild infection in the cavity, that you easily can control with the antibiotic.
How can I prevent future sinus infections after recovery? And are there any specific dietary or lifestyle precautions I should follow post-op?
Of course, both needs to be done. To prevent this thing I told you, it happens due to high level of CRP and toxic food. Lectin, gluten, casein you should avoid in your food, and wear a mask when you are exposed to dust.
How can I contact you, doctor?
You can contact, I am on various multimedia, Instagram, Facebook, phone number, all. Probably I'm the only ENT surgeon in Bangalore writing my number directly on my prescription, because I'm a surgeon. I'm supposed to treat the patient well. Any complication, it is my responsibility. Even night time, you can call us, send a message, we will reply to you.
Which hospitals and what time should I approach you, doctor?
I have 3 hospitals, one in Benson Town, one in Fraser Town, one in Kamanalli. Those are all called Divine Group of Hospitals. I go, and various other corporate hospital I go. I only go for surgeries in those hospitals. Those places are all junior doctors are already there. They will look after any major issues. I will definitely take an appointment and come and meet you all.
Okay. Thank you, doctor.
Thank you.